Okay, we're back with Dr. Gorfinkel, who apparently got the memo regarding pink. Think pink. Yes.
We're all doing it today.
Yes.
I'm not alone. Jeff, you look great.
Well, as do you.
Pink is an underutilized color. Wait, I'm a doctor. I'll stay in my own lane. Sorry.
Okay.
Sorry.
This is not a fashion segment. This is
no.
health. Okay. Going to talk the latest health headlines as always on a Friday with Dr. Gorfinkel. Here's something we have not talked about in a while. COVID. And the latest COVID variant is being called razor blade throat because it's causing a really severe sore throat.
That is correct. And this particular variant, no one ever even heard of it 5 months ago. And now it makes 2 out of 5 cases in the United States. So this is neck to neck with another variant, which is also similar symptoms. 7 out of 10 individuals who have this, it's called the Nimbus variant, get a sore throat. But it's the usual symptoms which you can't tell. Is it a cold, even allergies, sore throat, runny nose, body aches, fever, loss of sense of smell and taste, cough. So it's the same old symptoms. Good news. It is still sensitive to the vaccines that we have. It keeps people out of hospital, although it does not prevent transmission of the disease. And another piece of good news, it is detectable by the tests we're using.
Okay. All right. That is good news. Let's move to Alberta for a second, because Alberta healthcare workers there are, when it comes to COVID, we're still on the topic, are asking the Premier to reverse a new policy.
Yeah, this is kind of concerning. All of a sudden, the number of people who are eligible for free vaccinations by Alberta Health has vastly shrunk. So now it's people who live in chronic care homes, severely immune compromised, the handicapped, or people on social programs. So who is out? Healthcare workers. Who else doesn't count? Seniors who are living in the community, no matter how many underlying conditions they may have. This is a major change from what was.
Now, the government is saying that they've spent $135 million on unused vaccines.
I'm glad you're pushing back, but here's my pushback to that. How many people are going to be hospitalized as a result of not having access to the vaccines? So if they've got to pay, and I am not kidding, this is the price, $110 out of pocket, what is that going to do if people can't afford it?
Sure.
Because for people who aren't aware, the policy was for people to pay, right? If you're not covered?
The policy moving forward will be to
Pay for a COVID vaccination.
Right.
And to your point, I mean, this could get costly if it comes to hospitalizations, and we see more and more people in the hospital because they have not been vaccinated. All right, I want to talk also about this latest trend dominating TikTok. It's called Sephora Kids, and it's young people using anti-aging products. And there's a new study, Dr. Gorfinkel, that says these products contain irritating ingredients for younger skin. Excuse me. Is this a cause for concern, do you think? Or is this another Dr. Gorfinkel quack attack?
Bring out the ducks.
Okay.
Bring them out in spades. What is that telling our youth? You know, to value skincare products that on average, the regimes costed $170 and contain toxic ingredients. They're not meant for kids. It's sending the wrong message to them. So I really worry about it. But I did like the construction of the study. 2 doctors dressed up as, they didn't even dress up, they just pretended to be 13-year-olds online, gathered 100 different studies, and you know what? They look, these are videos that have 1 million views on average. And what are they saying to our youth? What are they saying to our young daughters? They're saying, you're not good enough. You're not worthy until you spend $170 on your skincare regime. And meanwhile, they're 7. 10.
Yeah, the messaging is certainly concerning, but also, the ingredients in this product concerning as well when it comes to young skin?
Yeah, many of them were toxic. Only 1/4 of them contained any sunscreen. I ask you, what is wrong with this picture?
Yeah, that is the most concerning. But the other part, yes, is, and you see it not just with anti-aging products, but also just with general cosmetics. That I feel like my new goal in life is to prove to my teenage daughter that you do not need to spend $50 on mascara. You can get a much more affordable quality mascara than that. But that is where influencers are, that's what they're saying online, and that's what they're gearing the young kids to go and do and buy.
It's a serious problem. I mean, if children are looking at videos that say They are not as valued if they do not spend $170, and that was the average price of these skincare regimes, $170. Then what does that say to their self-esteem? You know, that's become like this thing to have. You've got this little mirror filled with all these fancy creams that are bad for you. What can I say?
Yeah. All right. Well, we're going to have to leave it there on this Friday. Dr. Iris Gorfinkel with us. Dr. Gorfinkel, appreciate it as always. Thank you.
Many thanks.